Hi everyone, I have designed a health campaign aiming to replace false notions about vaccinations with substantialized data proving their efficacy. While this mostly targets parents of young children, it also pertains to an adult population reluctant to receive vaccinations specifically for COVID-19. Reaching these populations will help to limit the spread of disease and promote individual and community health. Vaccines are considered one of the greatest achievements of modern times. Because of them, people do not have to experience the devastating consequences of the diseases the vaccinations prevent. However, many people are hesitant about vaccinations. In 2019, the World Health Organization named vaccine hesitancy one of the top 10 threats to global health. Concerns about vaccinations are responsible for decreased vaccine uptake. Much of these concerns arise from misinformation about vaccinations. This campaign is designed to provide accurate information about vaccines to increase vaccination uptake and enable a healthier population. Studies show an increase in vaccine hesitancy among parents. Parents' confidence in vaccination has increased from 19% in 2000 to 50% in 2009. Reluctance to vaccinate children contributes to delayed and incomplete vaccination in children was largely responsible for the highest U.S. incidence of measles in the last 20 years. Because parents are decision makers in the vaccinations of their children, parents of young children are a target audience. COVID-19 vaccines are also raised hesitancy. Opponents called a safety of vaccine into question, spreading conspiracy theories, mentioning long-term side effects, circulating myths and misinformation. According to the results of a survey, racial and ethnic minorities have higher vaccine hesitancy rates than others, as do those living in rural areas, those with lower levels of education, and those with lower household campaigns. My campaign is intended to target these groups as well. Campaign goals and objectives. 1. Goals: 1. Increase awareness of vaccine efficacy and dangers of vaccination hesitancy. 2. Increase quality of health in targeted populations. 3. Increase the percentages of vaccinated children and adults. I would not change my goals. They were realistic and appropriate and based on facts and statistics from credible sources. Objectives: 1. Social media campaign to reach click-through and conversion rates of 5% by December 2024. 2. Increasing participation rates in community outreach programs by 10% by December 2025. 3. Launch an effective television commercial aimed at increasing vaccination rates by 15% by December 2025. I would not change my objectives. They are based on statistics and research. I believe the time frames are realistic and the objectives are appropriate. Method of communication. I chose to use a social media ad campaign as my method of communication because of my large percentage of the population that uses social media. I thought it was the most effective way to reach the masses and hit my demographic target. I am concerned that the advertisement is not personal enough, though. Community outreach might have been more effective in bringing about behavioral changes in individuals. That way, I would be sure that I focus on my target and take a more personalized approach. Promotional material design. Because I wanted to appeal to a diverse audience, I focused on the effects of vaccinations in communities. This would appeal to people's sense of responsibility to others. I chose an image from Pinterest that focused on communities and families and added it to PowerPoint, adding the logo was difficult because it was wordy and I did not want the advertisement to look too busy. I used the tools on PowerPoint to adjust the positioning of the picture and the letters in an aesthetically pleasing way. I think I did well with the materials I had. I wished I had access to more interesting photos and more advanced equipment to improve its appearance. I also would have liked to add bullet points with facts and statistics. Piloting activity. The purpose of piloting activity was to submit a sample of my promotional material and share it with my classmates to determine its effectiveness. One of my peers responded and she was quite complimentary. There was no constructive criticism because the feedback was positive. I did not adjust my material. If I were actually implementing a health campaign, the peer feedback would help me see my work from different perspectives. I could adjust my design to appeal to a broader audience. Campaign efficacy. I think my campaign would have been effective because of its clever message and ethical appeal. I believe the message is thought provoking and provides a unique angle on the importance of vaccinations. I wish the picture was more attention getting. If I had access to a wider selection of photos or could hire my own photographs, the advertisement might have been more successful. I also wish I had more advanced graphics on my computer to create it more eye-catching design. Had I had more advanced resources, I would have put it in more manpower to bring the design to the next level. The conclusion. My campaign was an effort to correct misinformation about the dangers of vaccinations and discourage vaccine hesitancy by transmitting evidence-based information. I learned that several myths about healthcare can be dispelled through education and that communication was key. I have learned how to research and design an effective campaign that appeals to appropriate demographics and the importance of piloting. I can use this knowledge to change unhealthy behaviors through communication and media. And here are the sources. The end.